Hi guys, it's your next Nurse Florence and you're welcome back to my channel where we talk all about health and wellness. In today's video, we're going to be looking into the topic type 2 diabetes mellitus. We're going to be talking about what it is, talk about the causes, the risk factors, the signs and symptoms, the complications, the prevention and management. Don't go away. To my subscribers, thank you for always sticking with me. I love you guys so much, and if this is your first time of visiting my channel, please subscribe, like and share. Namaste. Type 2 diabetes mellitus, also known or called non-insulin dependent diabetes mellitus or non-ketosis prone diabetes mellitus, results from the body's ineffective use of insulin. That is, the body becomes resistant to insulin and sugar builds up in the bloodstream. There's another type of diabetes mellitus called prediabetes. This could lead to type 2 diabetes mellitus. It occurs when the blood sugar is higher than normal but not high enough for a diagnosis of type 2 diabetes mellitus. There's also impaired glucose tolerance and impaired fasting glycemia. These are intermediate conditions in the transition between normality and diabetes. People with these conditions are at high risk of progressing into type 2 diabetes, although it is not inevitable. Type 2 diabetes mellitus is largely the result of excessive body weight and physical inactivity. The cells are resistant to the action of insulin, and the pancreas is unable to make enough to overcome this resistance. So instead of glucose moving into the cells where it is needed for energy, it builds up in the bloodstream. Exactly why this happens is uncertain, although it is believed that genetic and environmental factors also play a role. Until recently, type 2 diabetes mellitus was seen only in adults, but it is now also occurring increasingly frequently in children. The risk factors for type 2 diabetes mellitus includes 1. Age, usually seen in people of 45 years or older. This may be because one tends to exercise less, lose muscle mass, or gain weight. 2. Family history, if you have a parent or a sibling with the condition. 3. Race or ethnicity. It is unclear why certain people, including blacks, Hispanic, American Indians, and Asian Americans, are at higher risk of developing type 2 diabetes mellitus. 4. High blood pressure. Blood pressure over 140/90 is linked to an increased risk of developing type 2 diabetes. 5. Gestational diabetes mellitus. If one develops gestational diabetes mellitus when pregnant, there's a likelihood of developing type 2 diabetes later in life. Or if you give birth to a baby weighing more than 4 kg or 9 pounds, you are also at risk of developing type 2 diabetes mellitus. 6. Polycystic ovarian syndrome, also called PCOS. It is a condition that is characterized by irregular menstrual periods, excess hair growth, and obesity. It increases the risk of developing type 2 diabetes. 7. Abnormal cholesterol and triglyceride levels. The symptoms of type 2 diabetes mellitus is similar to those of type 1, but are often less marked. As a result, the disease may be diagnosed several years after onset or after complications have already arisen. The symptoms include increased thirst, increased hunger, increased urination, blurry vision, confusion, tiredness, irritability, sores that are slow to heal, recurring infections as a result of elevated blood glucose levels, which makes it hard for the body to heal. In men, it may cause decreased sex drive, erectile dysfunction, and poor muscle strength. In women, it may result in urinary tract infection, vaginal infection, yeast infections, or dry and itchy skin. To help prevent type 2 diabetes mellitus and its complications, people should 1. Achieve and maintain a healthy body weight. You should try to lose about 7% of your body weight if you are overweight or obese. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. 2. Eat healthy diets. Contrary to popular perception, there is no specific diabetic diet. You will need to center your diet on more fruits, vegetables, lean proteins, and whole grains. Foods that are high in nutrition and fiber and low in calories and fat. Also cut down on saturated fats, refined carbohydrates, and sweets. Sugary foods are okay once in a while, as long as they are counted as part of your meal plan. 3. Exercise regularly. Exercise lowers the blood sugar level by moving sugar into the cells where it is used for energy. It also increases the body's sensitivity to insulin. which means that the body needs less insulin to transport glucose into the cells. 4. Drinking coffee or tea may help reduce blood sugar levels, increase insulin sensitivity, and reduce the risk of type 2 diabetes mellitus. 5. Avoid sedentary lifestyle. 6. Avoid tobacco use. Smoking increases the risk of type 2 diabetes mellitus and cardiovascular diseases. High blood sugar damages organs and tissues throughout the body. The higher the blood sugar is, and the longer you live with it, the greater your risk for complications. The most common complication for type 2 diabetes mellitus is hyperglycemic hyperosmolar non-ketotic syndrome. This condition is caused by sky-high blood sugar that turns blood thick and syrupy. It can also be caused by dehydration, and it's often preceded by an illness. The signs and symptoms of this life-threatening condition includes a blood sugar reading over 600 mg per dl, extreme thirst, dry mouth, confusion, fever, drowsiness, vision loss, and hallucination. Other complications of type 2 diabetes mellitus includes 1. Cardiovascular diseases. Type 2 diabetes mellitus dramatically increases the risk of cardiovascular problems such as coronary artery disease, including chest pain, stroke, heart attacks, and arteriosclerosis, that's narrowing of the arteries. 2. Nerve damage or neuropathy. Excess blood sugar can injure the walls of the tiny blood vessels, that's the capillaries, that nourish the nerves, especially in the legs. This could cause tingling, numbness, burning, or pain that usually begins at the tip of the toes or fingers and gradually spreads upwards. If left untreated, one could lose all sense of feelings in the affected limbs. Damage to the nerves related to digestion could cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. 3. Kidney damage or nephropathy. The kidneys contain millions of tiny blood vessels called glomeruli that filters waste from the blood. Diabetes mellitus can damage this delicate filtering system. Severe damage could lead to kidney failure or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. 4. Eye damage or retinopathy. Diabetes mellitus can damage the blood vessels in the retina, that's diabetic retinopathy, potentially leading to blindness. It can also increase the risk of serious vision conditions such as cataract and glaucoma. 5. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. If left untreated, cuts and blisters can develop serious complications, which often heal poorly. This infection may ultimately require toe, foot, or leg amputation. 6. Skin conditions. Diabetes mellitus may leave you more susceptible to skin problems, including fungal and bacterial infections. 7. Hearing impairment, which is common with people with diabetes mellitus. 8. Alzheimer's disease. Type 2 diabetes mellitus may increase the risk of dementia. 9. Depression. Depression symptoms are common with people with type 1 and type 2 diabetes mellitus, and it can affect its management. The management of type 2 diabetes mellitus primarily involves diet, lifestyle changes or modifications, monitoring of your blood glucose levels, regular activities, along with diabetes medications, insulin, or both. Of all these, the most important management is diet. So guys, if you like this video and you want more health and wellness tips, please subscribe to my channel by clicking on the subscribe button for free. You can click on the notification bell so you'll be the first to know when I upload new videos. Give me a thumbs up by clicking on the like button. You can drop your comments in the comment section below if you have questions or topics you want me to talk about, and I'll attend to them. I remain your next door nurse, and I'm just a knock away. I love you guys. See you in my next video.